and welcome back to A1C to Z, the ABCs of diabetes. My name is Christina Bowie, and today I want to talk about diet. What is a diabetic diet? A diabetic diet is anything that restricts carb intake or keeps the carbs fairly consistent. There are many diabetic diets out there, so if you have a different diet that's been recommended by a physician or a dietitian, a diabetes educator, that's fine if you follow that diet. But this is the diet that we recommend to our patients. We found that it's more effective for a lot of patients because it's not as strict as some of the other diets out there, such as keto diet or Atkins. It doesn't completely restrict the carbs, which some patients have a hard time limiting their carb intake to that extent. So the first question we need to answer whenever we are talking about diabetic diets is, what are carbs? Carbs are anything that is bread, pasta, tortillas, rice, and patients always ask me if brown rice and wheat bread and wheat tortillas are better. And what I tell them is that brown carbs might be healthier, meaning that they have more vitamins and more nutrition, but they still have carbs. So we still count them for the purposes of diabetes. We still count them as carbs when we're counting our carb intake. Tortillas, rice, fruit. I really want to emphasize fruit here because, again, patients think that because fruit is a natural source of sugar, that it's better than other types of sugar. And while it might have more nutrients than, say, a piece of cake, it still has sugar and it will still raise the blood sugars up. Fruit, dairy products like milk and cheese, potatoes, corn, cereal, sweets, and beans. Pretty much everything except meat and non-starchy veggies. So we're talking like broccoli, cauliflower, lettuce, spinach, those types of things. The meat and the non-starchy veggies won't cause too many elevations in the blood sugar, so we're not as concerned about those things as we are the rest of the food groups. So we don't ask you to give up the carbs completely. We just ask you to limit your carb intake to about 60 grams per meal. And that is about 4 servings. So if you have a label that tells you how many grams of carbs are in your food, follow the label. If you don't have a label, then it's pretty easy to estimate your servings of carbs. So for example, you go eat at a Mexican restaurant and you want to order fajitas. That's fine, but you need to count your servings of carbs. 2 tortillas would be 2 servings, and we say that a serving is about the size of a baseball. So you have a baseball size of rice and a baseball size of beans. That is 4 servings of carbs. Your meat and your vegetables don't count. But when you start adding cheese and sour cream and chips and queso and 3 glasses of Coke, you've just doubled or tripled your carb intake. So compromise. If you have to have some chips and queso, get rid of the rice or the beans. Just try to keep it to about 4 servings of carbs. And even if you're not perfect, if you try to do this consistently, then even if you fall short sometimes, your blood sugars will still be better controlled overall. And then the other thing we ask you to do is we ask you to limit your snacks to about 15 grams of carbs per snack. So that is 1 serving about, which would be like a piece of fruit or some peanut butter and crackers. Anything that has about 15 grams of carbs in it. So what I tell my patients is that when you're doing your grocery shopping, start paying attention to how many carbs are in the foods that you're buying and try to buy snacks that have about 15 grams of about 15 grams of carbs per serving. Now, if you want to eat something that has a higher carb per serving ratio, does that mean that you can't have it? No, it just means that you need to eat it more sparingly and probably maybe stick to half a serving instead of a whole serving. Basically, if you follow this diet and you take your medications, however they're prescribed, then your blood sugars should overall be much better controlled. And then that's how we're going to prevent a lot of the long-term complications of diabetes that we've talked about in previous videos. Like always, if you have any questions about this material, feel free to post it in the comments section or send me an email and I'll get back to you. Make sure that you subscribe to my YouTube channel and like my Facebook page. Feel free to share this content with anyone that you think might find it beneficial, whether that's other diabetic patients, healthcare providers, nursing students, family members or friends, anyone that you think might benefit. Thank you so much and have a good night.